This leads us to my favorite exercise. It should be every physical therapist's go-to exercise for multiple diagnoses. It's walking, easily accessible. I don't care if it's 1 minute a day, 5 minutes. Ideally, 15 minutes a day makes global changes throughout the person's health and immune system. So that would be a good initial starting goal. Walking exercises every muscle in the body. It's considered the number one treatment for low back pain, as well as multiple other diagnoses. So, for the elderly cancer patient or anyone that has a diagnosis that's prevented them from walking much, make sure you pause on standing. Make sure you're not dizzy or nauseous, and sit right back down if you are. The number of falls I've seen right out of a chair are too many to mention. Once you're standing, I'm always encouraging everyone to walk like a young person. Heads up, we always say look down, fall down, shoulders back, swing your arms loosely, and get used to this kind of twisting motion, like the dance Let's Twist Again by Chubby Checker, very famous dance and song in the 60s and 70s. And kids do that movement for fun, which is a normal counter-rotational movement where the upper body rotates slightly opposite the lower body. If they can't get this, sometimes I use walking sticks in their hands or have slow, deliberate walking, which I'll show in a video in a moment. It's well worth mentioning that athletes, especially when I worked with them in the early 2000s, would do a 12-minute long rail treadmill warm-up where they would walk forward 4 minutes, backward, sidestep, all 4-minute segments to make sure they were strengthening all parts of their system. And I immediately, if I can, have my patient walking backwards and sidestepping in a parallel bar, hanging on to something, because any walk is a good walk as long as you do not fall down. And I'm going to demonstrate walking now.